my name is Serena Vasquez and I'll be doing my check off too. Helping me is my stepbrother. Do you give consent to this video?
I do.
Okay, so I've already washed my hands. I walked into the patient's room. I have introduced myself and now I'm gonna get started. I also have gathered my supplies, so I'm gonna provide the patient privacy and I'm gonna get started. So I am going to inspect the abdomen first. So in order is inspect, auscultate, percuss, and then palpation. So I'm gonna lift up the patient's shirt and I'm gonna make sure that he's covered as well. So I'm gonna inspect, I'm gonna get down to eye level. I see his breathing. I don't see any lesions. So I'm gonna get started and now I'm gonna auscultate. It does look symmetric, so I'm gonna get started. I'm gonna auscultate for bowel sounds in all four quadrants, starting in the right lower quadrant. Bowel sounds were active in all four quadrants. Now I'm going to percuss the patient's abdomen, so I'm gonna put my middle finger up against the patient's stomach and I'm gonna use my other middle finger to palpate. I'm looking for a tympanic sound. The sounds were tympanic. And so now I'm going to check the liver span. So I'm going to start down here and I'm going to percuss going up. It's going to go from a tympany sound to a dull sound. And so normally when I take the liver span, I would know where the dull sound starts and I would go all the way to the top, and usually it's about a 6 centimeter span. And so now I am going to check for spleen dullness. So I'm going to start near the umbilical, look for that tympany sound, and then move up and find that dull sound. That's where the spleen is. And so now I am going to do a palpation. So I'm gonna start with the light palpation. And I'm doing this, this is gonna tell me if there's any masses present. Do you feel any pressure?
No.
And so now I'm going to do a deep palpation. So I'm going to use both hands to do this. Do you feel any pain?
No pain.
And while I'm doing this, I'm also looking for a mass, for any masses, for any pain, for any tenderness. It's all good. And so I would palpate for the liver. So the liver's up here. There's two ways you can do this. So the patient can take a deep breath in, and then upon exhaling, I would go in and then look for his rib cage and push in down here, and then look for the liver. And then, or I could do a different maneuver where I kind of hook in under the rib cage and palpate for the liver. And then for the spleen, I would go ahead and do this. I would grab underneath the patient's back and look for the spleen. Both were not palpable, so I would document that in the medical chart. And so that concludes the abdomen. Now I'm going to start the neurological assessment. So I'm going to ask the patient his name. Can you tell me your name?
Sergio Gonzalez.
Can you tell me the date?
Today is April 26th, 2020.
Okay, and can you tell me your birthday?
October 1st, 1999.
And can you tell me what we're doing?
We're doing a neurological test.
Okay, so the patient is oriented. I'm going to make sure that he's alert to situation, to who he is, to what day it is, and what we're doing. So I'm going to start with assessing the cranial nerves. I'm going to have you kind of sit up and face me. So I'm going to ask you for the olfactory nerve. I would have the patient kind of close one nostril and then close his eyes, and I would give him a scent to smell, and I would have him do this for both nostrils, and he would tell me when he smells it and if he smells it. And then for the optic nerve, I don't have a pen light, but I'm going to use a pen. I'm just going to have him follow the pen. So with your eyes, follow the pen, okay?
Mm-hmm.
Just your eyes. There you go. Okay, so the patient has no difficulty following it, and then if I had a pen light, I would go in and kind of just check for his pupil dilation to make sure he's reactive to the light. And then for next, I would have him I would have him smile for me, and then frown, and can you stick your tongue out, and then, okay, and that's just checking his facial nerves. And so after that, I'm going to get this tissue, and I'm going to, can you close your eyes? I'm going to put this up against you. You're going to tell me if you feel it, okay?
Yes. 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 Yes.
Okay, so he does feel the tissue. And so now I'm going to do, I'm going to check his auditory, nerve. So I'm going to have you close this ear, and then I'm going to close your eyes. I'm going to whisper something to you, like a phrase or a word, and you're going to repeat it back to me, okay?
Mm-hmm. Hello.
Okay, now close the other ear. I'm going to whisper a phrase or a word, okay?
ABC.
Okay, so he is, his auditory nerves are okay. And so, or his acoustic. And then I'm going to, what else? I'm not going to perform a gag reflex test. And so then I'm going to move on to the cerebral function. So I'm going to have you stand up. So I'm going to have you stand up right there. I'm going to have you close your eyes. Just put your hands next to you. I'm going to make sure you don't fall, okay? So I'm just going to have him, this is testing his gait. I'm going to have him stand for a little bit. He might sway a little bit, but that's okay. I'm going to have the patient do this for about 20 seconds. Okay, sit back down. So that was great. He wasn't like swaying too much. He wasn't almost falling over. So his gait was great. That rhymed. So now I'm going to do the tendon walk. So, okay, stand back up. So if you sit over here or stand right there. So take a few steps or walk to the camera. And then walk back to where you were. So his tendon walk was great. And so now I'm going to assess the patient walking from heel to toe. So can you walk from toe to heel? Take little steps. And then turn around and walk back. Great. And so now I am going to have the patient kind of stand and look at me. So, can you see? Oh, okay, that did not work. Okay, so I guess you can sit down. So put your finger to your nose, and then move your finger to my finger, and back. Okay, so now can you put your hands to the side like this? And so can you go from hand to nose, finger to nose like this? The other way? Okay, great. And so now I'm gonna have your hands up like this, turn around like that. So now we're gonna do finger to finger and back. Okay, great. So those tests were great, and I'm gonna have you stand up one more time. And can you run your shin, your heel down your shin? The other one? Okay, great. Sit back down. And so now I would test for pain. So again, I'm going to use a pen, and this is testing to see if he can feel sharp or dull pain. So I'm going to use this. This is going to be, you would close your eyes. Tell me if you feel a sharp pain.
Yes.
And then do you feel a dull pain?
Yes.
Okay, so now I'm going to check your upper and lower extremities, okay? Close your eyes.
Yes.
Is that sharp or dull?
Sharp. Dull. 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 Sharp. Dull. Sharp. Dull.
Okay, I'm going to do your lower extremities, okay?
Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Dull.
Okay, don't open your eyes yet. Close your eyes.
Sharp. Sharp.
Okay. So he did confuse some of the. You can open your eyes. He did confuse some of them, but I went back and checked the same location with what I intended the pain to be associated with, whether it was sharp or dull, and he did great. So he did well on this test. And so now I would get a tuning fork to check for vibration. I don't have that, but I would kind of hit the tuning fork up against my hand, and then I would use the end of the tuning fork to kind of just place it along his upper and lower extremities, and he would tell me if and when he felt it. And so now I'm going to put my pen down, and so then actually I need my pen. So now I'm going to assess his palm. So close your eyes and tell me what I put in your palm. Feel it? What is it?
A pen cap.
Okay, a pen cap. Great. And so now I'm on this palm. I am going to write a number and tell me what it is, okay?
Okay. 2.
Okay. This is going to be a letter, okay?
M?
Yes. Okay, perfect. And so then I would assess his deep tendon reflexes. Again, I don't have the equipment, but I would assess his brachial, his what is it? Brachial, his triceps, and then I would assess his lower extremities. I would check his Achilles. I would check his knee. So basically, for this, I would have him relax his arm, and I would check the back of his elbow like that, and he would have a reflex. And then down here, I would just again bilaterally, but just for assessment purposes for the video, I would kind of just put my hand here, and I would use the tool to check for his reflexes. And then I would check his wrist, and then I would check his knees down here, and then I would check his Achilles. I would check his ankle. This does conclude my assessment. Thank you.